everyone. Welcome to day 4 of the Preemie Power Week. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation, CPBF, and your host for this event. The Preemie Power Week is the second of 2 international live series that CPBF is hosting 2020 in recognition of World Prematurity Day. These educational sessions are in collaboration with the International Family Integrated Care Committee, the Canadian Association of Neonatal Nurses, EFCNI, and GLANCE, the Global Alliance for the Newborn Care. For those not familiar with CPBF, we are a charitable organization, and our mission is to support and educate Canadian families of premature babies every step of the way. We believe that through consistent information, access to helpful resources, and peer support inside and outside the NICU, we can empower families, ensuring they are ready to care for their baby. Consistent information is especially important today when we are facing a global pandemic. With educational sessions like this, we intend to bring you the guidance of healthcare professionals and the knowledge gathered by researchers around the world. These are valuable tools to help our community raise awareness and advocate for the well-being of families and their babies. I would like to thank AbbVie for the unrestricted educational grant and Pampers for supporting the Preemie Power Week. And right now we're going to talk about technological innovations to support parents in the NICU. Parenting a baby in the Neonatal Intensive Care Unit is extremely stressful and a challenging experience. Over the past decade, technology has been developed to enable parents to connect with their babies even when they cannot be physically present at the bedside. This presentation will explore how technology might be used to better support parents in the NICU, as well as the challenges that may arise with such innovation. And I have here with me from Montreal, Dr. Jessie Duby, who is a neonatologist at Montreal Children's Hospital and an assistant professor in the Department of Pediatrics at McGill University. She obtained her medical degree at the University of Toronto and a Master of Public Health at the University of Waterloo. Dr. Duby completed her pediatric residency at Cornell Medical Center in New York City and her neonatology fellowship at the Hospital for Sick Children in Toronto. Her academic interests are in global health and family participation in healthcare. In the spring of 2020, she was awarded a technology grant from Pampers Canada and the Canadian Premature Babies Foundation. With this grant, she founded NeoConnect to virtually link families and their babies in the NICU through video chats and parental voice recordings. Dr. Duby, thank you so much for joining us here today. What a pleasure to have you and learn what you have done to innovate in the NICU during the pandemic.
Thank you so much, Fabiana, and the entire Premature Babies Foundation for giving me this opportunity. Today, I'm going to share with you some examples of how Montreal Children's has used technology to support parents in the NICU and how this might actually be applicable to your units. I want to start off by establishing an understanding of what is the most pressing issue that parents really need support with in the NICU. This past September, the Journal of Perinatology published a review of all studies that explored parental stress in the NICU. The review included 53 studies across 27 countries, and all of the studies used a well-validated tool when interviewing parents called the Parental Stressor Scale. This scale asks parents to evaluate how stressful specific situations are and categorizes them into 4 domains. So infant behavior and appearance might include questions about seeing your baby connected to wires and tubes. Parental role alteration includes items such as feeling unsure of how to help your baby. Sights and sounds are all the alarms and hustle and bustle that's going on in the NICU. And staff behavior and communication includes things like the stress that parents might feel with all of the medical jargon. What was remarkable was that parents from all over the world in just about every study reported the exact same domain as being the most stressful, the parental role alteration. What this tells us is that the area where parents most need support in the NICU is helping them learn what it means to be a parent when their baby is living away from home, enclosed in an incubator under the watchful eye of multiple nurses and doctors? How can we support parents in defining and carving out their essential role in their baby's life? What I find really interesting is that we're very comfortable with technology in the NICU when it comes to the direct medical care of our patients. We love the latest monitors, ventilators, and pumps that help us keep our babies alive. But I want to know if we can also use technology to alleviate the stress that parents feel from their role alteration. We know that parents' stress level and comfort in caring for their child have direct effects on their baby's long-term outcome. And so if we're truly interested in improving the health of our patients, we shouldn't limit our use of technology just to medical care. I have to acknowledge the elephant in the room and admit that it really was COVID-19 which led our unit to start exploring how technology can be used to support our families. While parents not exposed to COVID-19 still have access to their children in the NICU, we bar any parents who have tested positive or are under quarantine from being in the NICU, and all other family members are no longer allowed to visit, even if they're healthy. So we were very fortunate in May of this past year to receive a $25,000 grant from the Canadian Premature Babies Foundation and Pampers for the purpose of using technology to better connect our NICU patients with their families. With this grant, we created the umbrella program called NeoConnect. And there's really been two aspects that have facilitated its success and might be applicable to any unit, any project in any NICU. The first is that we created a multidisciplinary team of doctors, nurse practitioners, bedside nurses, music therapists, NICU managers, and educators to design and implement the program. We also surveyed our current families to ensure that the program was responsive to parental needs. The second aspect that facilitated our success was a bit of an imposed condition. The grant had a very tight timeline. It was awarded in the middle of May and expected to be implemented by the end of July. So because of this short deadline, we knew it was important that we didn't reinvent the wheel. And so we leveraged existing scientific evidence as well as the experience that other units in our hospital had. So with this guiding principle in mind, we started two projects: family voice recordings and family video chats. The idea for the voice recordings as a way to support our parents was based on the evidence about the impact of parents' recorded voices on their baby's health. There's a whole body of literature of the effect of parents' voices on their baby's development, especially for premature babies. But there's also some studies that show similar positive results if the voice is recorded. For example, NICU babies have shown to be less bothered by the alarms and monitors in the NICU if they're listening to recordings of their mother's voice. Premature babies have shown to develop a larger auditory cortex after being exposed to recordings of their mother's voice compared to babies who didn't. And finally, there's a really cool study that tests these pacifiers that play the mother's voice when the baby sucks, and preterm babies who use these pacifiers learned how to feed faster compared to babies who didn't. So with that in mind, we purchased these handheld recorders that are provided to every parent for the duration of their baby's stay in the NICU. We encourage them to read, sing, or talk to their baby, and the recorders are kept at the baby's bedside and played whenever the parents cannot be physically present. And I think everyone in our unit has been remarkably surprised at how our patients calm down once they hear their parents' voices. But we really wanted to see if these recorders helped our parents as much as they were helping our babies. So we've started to survey some of the parents that have participated in the program. And I just wanted to share two quotes that I felt really embody the parents' experience with this project. One parent said, "Recording our voices was a good experience because we know our baby will somehow feel our presence even when we're not around." And another said, "I felt less pain when I would leave my baby, knowing that she would calm down and relax when she heard my voice on the recorder." Out of the two projects we implemented with NeoConnect, this one required the least effort and is probably the easiest to replicate either by an individual parent or an entire NICU. With the disclaimer that I don't have any ties to Sony, we did purchase their recorders for $78 each off of Amazon and have been very pleased with their small size, simplicity, and performance. The recorders are always kept in sandwich bags for infection control reasons, so the nurse can disinfect the bag with a wipe at the beginning of their shift. So for any parents listening to this talk, you could also do the same thing with an old smartphone that you're no longer using if you don't want to purchase a recorder. I think most NICUs would be receptive if you brought in a recording of your voice and asked the nurse to play it when you aren't there. And for NICUs interested in implementing this project, we found that it was very easy to combine the distribution of the recorders with any type of welcome package that you might be providing your families when they're admitted. And on discharge, whoever in your unit is in charge of removing supplies from the room can be assigned to delete the recordings and return the recorders to a central location. The second project was a bit of a bigger beast, but we made use of the experience from another initiative that was taking place in our health center. We're attached to an adult hospital, and so when the COVID-19 pandemic hit, the adult side, like many adult hospitals, closed themselves off completely to all visitors. So they actually quickly bought tablets and introduced an initiative to ensure that families of dying patients could see and talk to their beloved ones through the tablets. What that meant was that the IT support, protocols, and infrastructure for video chatting were already in place, and all we needed to do was adapt it to the NICU context. So we bought the same Samsung tablets, used the same platform that the adults were using, which is just WhatsApp, and we also bought mobile rolling devices that the tablets could plug into. Parents have the opportunity to schedule appointments to video chat with their baby and providers. The times we're using the chats are during medical rounds when we encourage parents to participate. Parents will also schedule the video chats during when a nurse is doing her cares, and they can receive updates at that time. We've also used the chats during family meetings, especially if one parent is able to be physically present while the other one is at home taking care of other children. And then some of our lactation consultants have started to use video chats to guide mothers at home with pumping tricks if they're struggling. Since starting the video chats, we found that at any given time, there's really only a minority of patients' families who make use of the chats because they can't come to the NICU, but those that do often use them daily. While some of our parents use the video chats because of COVID, I think not surprisingly, we've had a whole host of other parents who have difficulty visiting, either to living far away from the hospital or having other competing responsibilities that have made use of the chats. One time that has become very popular is in the immediate hours after a mother gives birth to her premature baby, when she might not be able to visit the NICU because she just had a C-section or has other medical complications. And finally, we found the tablet uniquely helpful for one of our long-term patients' mothers who had severe agoraphobia, limiting her ability to leave her house for any reason. She eventually did start coming to the NICU, and she attributed her ability to see her baby and the NICU through video chats as motivation to overcome her anxiety and visit the NICU. So this project is definitely a bit more effort to start up, as it requires some amount of IT support and administrator support, but it doesn't have to be as big of an endeavor as we've made it. I think you can always start with the lowest hanging fruit, the parents that cannot visit at all. And these are usually only a few select cases, such as being quarantined for COVID. So to target those unique cases, you really would only need one tablet to start. And while tablets can undoubtedly be as expensive as you want, the cheapest ones like Amazon Fire actually cost only around $60. And although I think it is helpful to have a stand for the tablet, again, you may want to pilot the project with a cheap stand that doesn't have all the bells and whistles, but can at least help to embed the project within the culture of your unit. I want to briefly tell you about what we're currently working on for the next steps of NeoConnect, as I think it's another way to support parents with technology, especially during the pandemic. As many NICUs did, we used to hold casual in-person workshops in our parent lounge. But with the COVID pandemic, all of these parent workshops have been canceled. So what we're doing now is we started to create a video library that we're going to upload on all of our tablets and make them available for parents to check out and watch while they're in the NICU. While some of these videos are homemade, many videos to support parents in the NICU are already publicly available, such as the wonderful talks recorded by the Canadian Premature Babies Foundation that are available on their YouTube channel. In Quebec, we're a bit more constrained in picking our videos since it has to be available in both French and English. But for those of you considering buying a tablet for your unit for video chats, I think this is a second purpose of the tablet that can be used to convince your NICU of the value of them. Even without tablets, you can easily make a YouTube channel of all the reputable and publicly available videos for NICU parents and give out that link. Before closing, I do want to highlight some research that has been done elsewhere on other forms of technology to support parents in the NICU. At Northwestern in Chicago, they have created a smartphone application called NICU to Home to help parents prepare for discharge. The app includes education material, a way for parents to track their baby's sleep, diapers, and other activities, and a discharge checklist for items that parents need to complete, like CPR training. Compared to parents who receive the unit's standard discharge education, parents who use this app felt more ready to take their baby home. And the NHS in the UK has designed a video app that allows participating NICUs to send short video clips to parents of significant moments in their baby's life, such as a first feed or a first time being dressed in regular baby clothes. A study of this app found that parents who used the service reported reduced stress and increased emotional closeness with their baby. So in summary, I hope I've demonstrated that technology can be used in creative ways to support parents to be involved in their baby's care in the NICU. Family voice recordings are an easy way to have parents have a profound impact on their baby's physiologic stability and neurodevelopment. And family video chats can break down the physical barrier for parents that cannot visit the NICU. And finally, I think that NeoConnect taught us that for any NICU initiative, a multidisciplinary team with parental input is essential. And really, it's important to leverage existing evidence and expertise when starting anything new in the NICU. Thank you so much, and I'd be happy to take your questions.
Dr. Wood, thank you so much for your presentation, and congratulations on stepping up so quickly in the middle of the pandemic to implement technology in your unit. I know how stressful it was with a very short time limit, but I'm in awe to know what you've done in just a few weeks. It's absolutely amazing. So congratulations to you and your whole team at the hospital. So I have questions to you. And first of all, actually, I want to acknowledge people joining us from Indonesia, Ghana, Halifax, Edmonton, Madrid. We have people from all over the world listening to us right now. Thank you all for joining us. We really appreciate your support. Dr. Duby, what is going to happen with technology after the NICU? After the pandemic, are we still keep using this technology to keep parents connected once the pandemic is over?
I think it's going to be similar to how we're all seeing what technology is going to do for all of us when the pandemic is over. I think Zoom meetings are going to become more of the trend. And similarly, I think technology in the NICU is really here to stay. Again, we're very comfortable with technology when it comes to the medical care we give our patients. So there's no reason that we can't continue to use it to support our parents.
Absolutely. So we have a comment here. Let me see if I can put on our screen. Infection control seemed to be a barrier in our NICU experience, as we were not allowed to bring any electronic devices into or near our baby's space. What precautions are in place to avoid spread of infection to babies? I saw a plastic bag on the recorder. You were told that was not enough and had to do without any electronic interactions. Thanks, Lindsay, for your comment and question.
Yeah, thank you. I'm not sure if my screen is still showing. I mean, we also had to meet with our infection control people to get their approval. And right now, when parents come into the unit with their cell phones, in our unit, they're all required to put their cell phones in a plastic bag because we know cell phones have a lot of bacteria on them. So similarly, our infection control has been willing to allow us to use these recorders as long as they're in a plastic bag and wiped down like any other hospital equipment. And for our tablets, they're encased in a protective cover, and all of these are also wiped down before being used and after being used, the same as you would for any medical equipment.
Absolutely. Dr. B, now we've been talking about technology, keeping parents connect with technology, but I feel that you are a very big advocate to keep parents together with their babies, and the technology is a piece to enhance that connectivity. So parent organizations from all over the world are concerned that technology can substitute parents, especially in units around the world, that parents are not as welcome as our hospitals in Canada. So what piece of advice or recommendation would you have to these units on how to best integrate parents in the NICU with the use of technology?
Yeah, that's a very good point. I think, again, the best is to have the parent right there. And so I think all of the steps to encourage parental visitation and kangaroo care, those all need to be in place before you even think about bringing in technology. Again, this technology is just to supplement for those times that the parent cannot be there. Ideally, we would have live-in rooms in the, I think there's even some units in Europe that do that, where the parents can even move in and be with their baby, because the idea is the parent should be the primary caretaker. The only reason for really instituting this technology is because we're realistic, knowing that parents can't be there 24/7. So really, I think technology should take a backseat to the in-person connection and should only be brought in once there's good visitation policies already in place.
Absolutely. This is so important to keep parents connected all the way. Parents' presence, we know through research how important it is for babies' development, brain development, and parents, especially the parental stress on keeping, babies together so there's no separation. Dr. Duby, I thank you so much for your time today, for sharing your experience, what you've accomplished in the times of the pandemic in your hospital. We are very grateful to have you with us today. Thank you.
Thank you so much. I look forward to hearing the next speakers.
Absolutely. Thank you.